I'm Dr. Charles Batte. I'm founder and team lead of the Wulira App. I'm a medical doctor at Mulago Hospital and also work with Makerere University as a health economist. My innovation is called the Wulira App. Wulira translates loosely into, from Luganda to English, do you hear? When individuals acquire tuberculosis, it's not a death sentence. We have medications, we have drugs that can treat tuberculosis. However, one of the most important side effects of these drugs is that they cause hearing loss to our patients. So in the end, we end up curing people of tuberculosis, but giving them a lifelong disability that is hearing loss. To diagnose hearing loss, we use Pure Tone Audiometry, which is not available nationwide, which is expensive, which requires a specialist audiologist to do. So we've identified that gap and we've developed a mobile phone application that can be used in the place of Pure Tone Audiometry, increase access to hearing loss. The Wulira app is a simple to use but robust Android-based mobile phone application that has been developed based on the principles of Pure Tone Audiometry. Each individual is able to perform a hearing assessment on their own. We've developed calibrations and algorithms that enable all kinds of headsets to be used and provide a diagnosis for the patient who is taking the hearing assessment. Upon diagnosis, the patient is connected to a specialized ENT doctor and can make an appointment through the application to follow up on their hearing loss. In the immediate future, our biggest market are the programmatic settings, programmatic treatment centers for tuberculosis, especially multi-drug resistant tuberculosis. We have about 17 treatment centers for tuberculosis in Uganda, but the same implementing partners operate in all Sub-Saharan countries, and that gives us potential for scaling up beyond Uganda. Other programmatic settings we are looking at are treatment centers for HIV. HIV has been seen to be associated with hearing loss. Patients on anti-cancer drugs can use our application to monitor the effect of their medications on their ability to hear. Secondly, the general population. Several people experience hearing loss due to variable reasons. The elderly experience age-related hearing loss, and young people who listen to loud music experience hearing loss without even knowing about it. So this application is going to be very vital to this market segment in that people will be able to monitor themselves without even the assistance of a health practitioner to be able to ensure that they do not develop the debilitating hearing loss that they are predisposed to. We've already released a beta version of the application. It is available for download on Google Play Store. Our application is also available at Mulago Hospital, where we are going to be conducting a validation study. In the validation study, we will test individuals using the Pure Tone Audiometry, which is the gold standard for assessing hearing loss, and also test them using the application. And then we will scientifically determine the sensitivity and specificity of diagnosis of hearing loss of our application compared to the Pure Tone Audiometry. And that's when we will be able to be very certain to say that Wulira App can replace or can supplement or augment Pure Tone Audiometry in treatment centers around the country. First, we want to roll it out in all treatment centers in Uganda, MDR-TB treatment centers, to ensure that each patient who is started on MDR treatment actually has hearing monitored on a monthly basis. Secondly, we want to talk to implementing partners for tuberculosis all over Africa to see that our application, our software, is introduced in all other treatment centers across Africa to be able to bring this service simple, robust, but accessible to all patients and prevent the debilitating hearing loss that is associated with MDR treatment. But also for policy and planning. the government needs to have data on the prevalence of hearing loss in the country to be able to plan for this population. We therefore hope to do a prevalence survey for hearing loss in the country so that we have country-specific data on this problem.